All right. Good morning, everybody. Hello. Dr. Rafich here from Vet Triage. Thanks so much for those who are watching this who will watch this in the playback. And a bit late this morning. It's about 10 a.m. Pacific time, July 14th. Well, let's do it. We're going to talk about lymphoma. So lymphoma in dogs specifically, we're going to focus on. It's very, very common. It is the most common hematopoietic disease that we see, slash lymphatic disease. And if I would say probably overall in cancers, it's probably like top 3 most common for dogs. So there's different types of lymphoma. Oh, let's backtrack. Lymphoma is a cancer of the plasma cells, which are part of the immune system. There's B cells and T cells that make up that category of cells, and they're responsible for making antibodies and fighting off infections. In brief, that's pretty much what they are. Plasma cells and lymphocytes are the names of those cells, the normal cells. And so cancers of those are really devastating because those cells are everywhere in the body, and lymphoma therefore can be anywhere in the body and very likely to spread. So there's different types of lymphoma, and multicentric, which means it's in either lymph nodes, liver, spleen, or a combination, is one of the more common forms that we see. You can have lymphoma of the skin, of the mucocutaneous junctions, the central nervous system, as well as bone. So lymphoma can be anywhere in the body because these plasma cells and lymphocytes are anywhere in the body as well. So it is considered a systemic disease, with the exception of the one that's localized to the skin. That one's called a epitheliotropic lymphoma. That tends to stay to the skin, otherwise, or the oral cavity. Otherwise, extranodal lymphomas are not known to spread, but the rest of lymphoma types are typically considered systemic. So if your dog has lymphoma, it's not of the skin, it's presumed to be in multiple areas of the body. It's just a matter of the veterinarian trying to figure out where. The workup for lymphoma can be quite extensive because of how diffuse it is in the body. For the most part, your veterinarian is going to want to collect 3-view thoracic radiographs, so x-rays of the chest cavity. And the reason for that is to look for cancer spread in the lungs. That's the main reason. Abdominal ultrasound is a adjunctive tool to the radiographs. They're synergistic. The abdominal ultrasound will look at liver, spleen, lymph nodes, all the organs to see if they have shown any evidence of lymphoma infiltration. And then when you actually want to diagnose the condition, you're going to collect a sample of whatever tissue or tissues are affected. So, for example, if the lymph nodes are large, your doctor is going to place a needle in the lymph node, aspirate cells, and either look under a microscope themselves or submit it to a laboratory for a pathologist to evaluate. And once the cytology comes back positive for lymphoma, you can then have the lab perform an immunophenotyping of the cells. That tells you, are they B cell, T cell, because the prognosis can be affected by what type of cells they are. Then the other possibility, and by the way, you can also aspirate, spleen, liver, whatever organs look abnormal to you, you can aspirate and submit to the lab for evaluation. And then the other way of confirming a diagnosis, which will give you a higher accuracy, is a biopsy collection. So histopathology is the evaluation of cells on a slide that are collected from a actual tissue sample that was collected by the veterinarian via biopsying. And those are typically indicated in situations where the cytology was not definitive, or maybe you only have one lymph node affected in that pet, or you have lymph nodes that are kind of slow growing, or you're just desiring to have more detailed histologic information regarding that case, then a biopsy is the way to go. Otherwise, this is a disease that classically can be diagnosed with high certainty from cytology alone. And then finally, you can consider advanced imaging like computed tomography, which is CT or CAT scan, or MRI, which is magnetic resonance imaging. And that can give you a lot of information regarding the entire body. It's especially useful for those cases that you suspect have lymphoma in the central nervous system. Okay, let's talk about treatment options. And again, this is all for dogs. There's a variety of treatment options because not everybody can afford chemotherapy. Not everybody wants chemotherapy. And so the treatments can go from very basic to very complex. At the most basic level, prednisone therapy. Prednisone is a steroid, and it has many, many functions in the body, including suppressing the immune system as well as being anti-neoplastic, which means anti-cancer. And prednisone is a cheap and easy way with minimal side effects, or at least minimal serious side effects to it, that you can manage these dogs. It won't be as potent as chemotherapy would be, but it is an option for those who don't want to go through chemo or can't afford it for the dog. Next step up from prednisone is single agent chemotherapy, meaning a chemotherapy plan that's based on one drug, one chemotherapy drug. And now, technically speaking, prednisone can be considered chemotherapy, but most of us don't really regard it that way. So any other class of drug that's considered chemotherapy outside of prednisone would be considered a single agent chemotherapy. And then, of course, if you added multiple agents, then it's multi-agent chemotherapy as the next tier. And then after that, there are specific chemotherapy protocols. The CHOP protocol, for example, is a common one, CHOP. It's an acronym that describes what drugs you're using. So in that case, the C is cyclophosphamide, the H is doxorubicin, the O is vincristine, and the P is prednisone. And so there are many different types of unique protocols for lymphoma, for chemotherapy. They have similar abbreviations that can be used, and that's based on whatever research is out there and your oncologist's preference of what to use, what's been most successful for that specific situation. Then there's monoclonal antibody treatments, so T and B cell monoclonal antibodies. The idea behind monoclonal antibody, monoclonal means of one type, one clone, and antibody is proteins in the body that attacks foreign substances, foreign pathogens, whatever. And so the idea here is to train the body to view these lymphoma cells as being foreign, and therefore the body's natural immune system can fight the cancer. And it's a very popular methodology over the past 10 years or so to try and fight cancers. So that's pretty cool. And then finally, you can consider bone marrow transplants in animals as the next tier of therapy. And you can also consider half-body radiation therapy as well. So, which means radiating half the body, or the half of the body that's affected by lymphoma. And so those are your different therapy options. You'll talk to your oncologist in depth. You can talk to veterinarians on vet triage about it as well. And then the next question, of course, is what's your median survival time? How long do these dogs last? If you use prednisone alone, you're getting about 2 months. And not a lot of time, but it's enough to give some quality of life, maybe buy you some time to think about what you want to do with your pet as far as pursuing chemotherapy and these other options or not. But about 2 months of time is what you get with prednisone. Single agent chemotherapy varies widely, of course, because it depends on what drug you're using and how you're using it and all that, your dog's response to it. But typically less than a year is what you're looking for with single agent chemotherapy. Multi-agent chemotherapy can be a year, and then bone marrow transplant and radiation may have added benefit, but it's unknown as far as what kind of duration of longevity you're looking at. And then finally, let's talk about prognostic factors. Prognostic factors are those factors that influence why one patient survives 2 months on prednisone and one survives only 2 weeks on prednisone, for example. It tells you what factors affect longevity, the prognosis. T-cell lymphoma, the T-cell phenotype, is considered a worse prognosis than B-cell. And the way to remember that is T for terrible. B for better. Stage 5 lymphoma, which is those that are extranodal, meaning outside lymph nodes, or they affect bone marrow, or they affect gastrointestinal tract, are way worse in stages 1 to 4. And substage B, which means your pet is sick, versus substage A, which means your pet is not sick. The substage B has a worse prognosis. And then finally, high-grade lymphoma or lymphoblastic lymphoma, which is again a high-grade version of lymphoma, also have a worse prognosis than your standard lymphoma. So hopefully that helps you guys out. It was kind of quick, but lymphoma is a very complex one that has multiple facets to it. And we can talk about cats in another live stream for lymphoma. This is also very common cancer in cats. Thanks to everybody who watched us on the playback. Let's see, we had 3 attendees today. Wow, fantastic. We broke our own record. I'll see you tomorrow, July 15th, for another live stream, and we'll talk to you then. Take care. Bye-bye.